is Sierra. I'm going to be your nurse today. Can you state your name and date of birth for me?
Hi, my name is Marissa. July 19th, 1997.
Okay, I'm just going to confirm that with your wristband. Okay, good. All right, I'm just going to wash my hands. So your speech is clear, you're conscious. Your facial expression, you have a smile. Are you having any pain today?
No pain.
Okay. And I'm just gonna take your blood pressure, and then I'm gonna take your temperature. So your temperature is 98.6. Your blood pressure is 110/60. I'm just gonna count your respirations for a minute, and those are 17. So you have no labored breathing. How is do you feel like you're having any difficulty breathing, or?
I have a little bit of a cold.
Okay,
But
all right.
nothing crazy.
But your lung expansion looks good. Your chest is rising and falling well. Let's see. What's your mood today?
I'm like good mood.
Yeah. And do you know where you are?
Yeah, I'm at the Lamson Library.
All right. And do you know what time it is and what the date is?
Should.
September 26th.
September 26th.
Good job.
It's
All
a
right.
Wednesday.
Do you know who the president is?
Trump.
Yeah.
It's just
Unfortunately.
I think we just voted.
Okay, so I'm just gonna kind of take an overall look over your skin. Do you have any lesions that you want me to know about before I proceed, or? Okay, all right. So your arms look good.
It's like a
And I would have the shirt off, but in this case I won't do that to you because we're in the library. Your hair distribution is good. I like your hair color. You look like you're perfusing well. Your skin is nice and pink and warm. Let's see. I'm gonna just feel if you have any like swelling in your legs or. Nope. And I'm just gonna feel your pulses on your feet. Okay. And so what I'm doing is this is the posterior tibialis pulse, and this is the dorsalis pedis pulse. I'm gonna do that on the other foot. And those are both good. And I'm just gonna do your radial pulses. Can I have the other one? Okay, good. Those match well. And I'm just gonna check your capillary refill in your fingers and capillary refill in your toes. Good, those are all under 3 seconds, probably about 1 second, which is very good. Means you're perfusing well. Your hygiene looks good. You look like you shower and everything, and like you change your clothes. And I'm just gonna check your skin turgor, see if there's any tenting. Looks like you're well hydrated. Do you drink enough water? Good. I see you have a cup of coffee right there, but let's see. Can I just have a look inside your mouth? And can you stick your tongue out for me? Okay, your tongue is a good size. Your teeth are all intact. Your oral mucosa is a nice pink and moist. And your skin feels nice and warm, and it doesn't feel too dry or too moist or anything like that. Okay, now I'm gonna just have a look at your neck and just feel your lymph nodes, any swelling, any tenderness there. Okay, now I'm gonna feel your carotid pulse. And you're never gonna feel them both at the same time.
Why is that?
Because you don't want to pass out, because otherwise I would cut off your blood supply.
That's a good idea.
can feel those both pretty well. And then, can you just kind of tilt your neck to the side? I'm just going to assess for any distension in your jugular vein, which I don't see any on this side. And now tilt your head the other way. No distension. Okay, good. All right, now I'm going to just inspect your chest area to see the symmetry in it. And overall, like the color, I'm just gonna look. So that looks good. All right, so I think next what I'm gonna have you do is I'm gonna just have the chair turn this way, if that's okay. I can stand up for a minute. So what I'm doing now is checking for tactile firmitis. So I'm gonna just go like this down your back and listen to see if there's too much vibration or too little. And that sounds good. Okay. And then I'm just gonna have you lean forward, and I'm gonna put my hands like this and just have you breathe in and out. So I'm just checking for symmetry in your chest, which they're very symmetrical. Okay. And now I'm just gonna percuss your lungs, and I'm just gonna lift the back of your shirt up while I do that. And I'm just listening to see if there's any dullness, because that could mean that you have like some fluid in there. I don't hear any dullness, so that's good. All right, so I'm just gonna have a listen to your lung sounds. If you could take some deep breaths for me, in and out. And again. And again. And again. Okay, and I'm just gonna listen to your anterior lungs. I just did your posterior. So some more deep breaths for me. Deep breath. Okay, your lung sounds very clear. All right, so next I'm gonna have a listen to your heart. So first I'm gonna check your aortic. And what I'm listening for is the lump duct sound, which is S1 and S2. And now your pulmonic. Erb's point. Tricuspid. And then I'm just going to go up under this way to listen to your mitral, or the apex of your heart. And we would listen to that for about a minute, just to get the count on that and make sure we're definitely not hearing any irregularities. And so far your heart sounded really good. And I think that concludes our assessment.